When you have to get your breast exams, what goes through your mind?
I
So today we have joining Letrice, who is a nurse practitioner and also a owner of the lovely Her Down There clinic. What are things that women can expect their breasts to experience during perimenopause?
I have a lot more patients who have like lumpy bumpies, is what
Uh-huh.
I usually call them. And it doesn't even matter the age. Even when you go to other countries,
Yeah.
you never see those women have any of the issues that we have. It is super duper rare over there. But also, our moms and our aunts, it was so taboo to talk about things like that.
Exactly.
Like out of nowhere, you feel zaps of pain. Typically, it's somewhere in the chest or your arms or legs, but it also happens like, in your breasts.
Does it feel like electric or does it feel,
Yes.
yeah. And as a kid, I was like, come on, Lord, this is the
What's
last
going
thing
on? And sometimes they grow it on their breast.
Yeah.
Usually it's here, but there are times where it's like thick, long hair on their breast. Man, women definitely go through a whole lot of stuff.
Yes. Men don't know the half.
Half of it.
They probably would have started laying on the bed with a cross and a Bible,
Right?
something like this is it. This is how
This is it. I'm over. Yeah. Jesus, come get me.
So, are there any differences in your breast between perimenopause and menopause? Or
Oh, I'm glad that you brought that up. Yes.
let's talk
We
about
we always forget about little old
now.
prolactin.
Did you say wild yam?
Yeah.
But I like that. I think that a lot of women need to learn about it because they just kind of deal with it.
And there is a solution. And it used to
Yeah.
be where we didn't have a solution, but now science has evolved and we're now focusing a little bit more on women to let them, feel better and like they're not.
Let's talk about breasts. Let's talk about you and me. Let's talk about all the good things and all the bad things.
Welcome to episode 72 of BoobTube. I'm your best friend, Jaleesa, and we're here to talk about some breast health. As you can see, have someone that can answer some very pertinent questions for us today when it pertains to our breast health. But first, of course, let's take BoobTube on the move.
What do you think goes through a woman's mind during a breast exam?
She got some nice titties. I mean, she got some nice boobies.
The woman that's receiving the exam, sir.
That's why the doctor feeling on her.
So she's thinking to herself, like, man, my titties are nice, and that's why they can feel. Oh, okay. I thought maybe you were talking from the doctor's
No, no,
perspective.
no.
And see, that's why we shouldn't have male gynecologists because they are creeps. Anyway, what goes through your mind when you're getting a breast exam? Please don't touch me.
No, for real.
This
For
is
real.
nice.
This is weird.
I understand that. And have you ever had any medical concerns regarding your breast?
I have not. Not really. I do need to. I told my doctor a little bit though. I need to get a mammogram earlier. You know how when you find out when it's on both sides,
Yeah.
and you're like, okay, I'm supposed to have it before 40. And she laughed at me because I was trying to talk her into like doing an ultrasound instead of like squeezing my titty,
I get what you mean.
because that's trauma
Right.
to the boob.
It is. It's less. It's just less to do the ultrasound.
Yeah, you
Or
can see the
even-
same thing.
Yeah, or
with
even
less
mammography.
trauma.
Yeah. What do you think goes through a woman's mind during a breast exam?
Uh, I don't know actually. I couldn't even. I don't know.
I don't know what it's like to be a woman.
No, I don't. Not at all.
Okay, so with it, at least one of those were unexpected. Another one was somewhat expected, and the other I respect because, at least he's saying as a man he can't think of what it's like to be a woman. So that's cool. I respect that. And you never know what you're gonna get in those boob tube on the move streets. So without further ado, let's go ahead and get some information from our guest. So today we have joining Letrice, who is a nurse practitioner and also a owner of the lovely Her Down There clinic located in Houston, Texas. So of course, make sure that you go check her out. But without further ado, welcome to BoobTube.
Hello, how are you?
I am great and happy to have you here.
Happy
So
to be here.
Thank you. So we can dive right in. I did give that brief intro, but would you like to share a little more about who you are and what you do, or maybe about the clinic?
Sure. So we have had the clinic for about going on 4 years now. We are in the Montrose area. We specialize in women's health with pap smears and breast exams. We also do hormonal testing and STD testing, etc. We are just happy to help women however we can on a daily basis.
Of course. Love to hear that. Always loving to hear women supporting women in all ways possible because there are so many ways.
Yes.
That's why we're all here doing the Lord's work in one way or
Right.
another.
Very true.
Okay, so one of the Boots on the Move questions we ask is, what do you think goes through a woman's mind during a breast exam? So for you, you can answer personally when you have to get your breast exams, what goes through your mind?
I honestly think it's weird. It's a weird feeling to have someone, especially if it's like your first visit with the provider, to
Yeah,
just have someone kind of feeling you up for the first time. So
yeah,
it is a weird feeling. And then the other thing that kind of goes through my mind is what exactly are they like feeling for? Or
yeah.
did I miss something when I did my own breast exam and hoping that nothing bad comes from it?
Right. So you start to kind of second guess yourself, like, wait, did I get this
Yes.
right? Did I miss something?
Right. Right.
Okay, and on the opposing side, with you giving breast exams, what's something that has stood out in your mind while giving a breast exam? Maybe something different than the norm or funny or something like that?
Well, I would probably say what's going on in my mind is I have a lot more patients who have like lumpy bumpies, is what
Uh-huh.
I usually call them, and more than you even realize. And it doesn't even matter the age. And I think that as we're evolving in this world, we're just having more what we call fibrocystic breast or dense breasts that have a lot of just kind of lumps in there. And then I'm surprised at how much the patients don't realize that they have it.
Yeah. And
Yeah.
we heard about that with giving with breast exams because some women, especially if they're not accustomed to doing self-checks, then they
Yeah.
don't know what they're feeling for. And then if they do and they feel their dense breast, they're like, oh
Scared, like something. Yeah, what is this?
yeah.
Yeah.
It's like it's really just how your breasts are composed.
Right, right.
So yeah, I know what you're talking about. And
Yeah,
I can see how that's a pretty common thing that you encounter there at the clinic for sure.
very often. Yes.
Okay. So, what are things that women can expect their breasts to experience during perimenopause? That's something
Okay.
that's I see that people are learning more about it these days. A lot of women didn't even know about perimenopause, they just knew menopause. So, I
Yeah.
want to shed some light on that one.
So I would say they can start to express more breast tenderness
Mhm.
because the fluctuation of estrogen in your body will definitely make your breast feel tender. And it doesn't have to be around your cycle. It can be anytime, during the entire cycle. And then I would say another thing is, which is kind of weird, like zaps of pain or
Ah,
like sharp, like out of nowhere, you feel zaps of pain. Typically, it's somewhere in the chest or your arms or legs, but it also happens like, in your breasts, but completely normal.
does it feel like electric or does it feel
Yes, very much so. Yeah, like someone shocked you really quickly. Yeah.
see if I felt that before. I might
I
have.
know, right? The funny thing is we feel a lot of things, but when it happens once, we just really don't attribute it to anything else. And so
Right.
we just kind of go on with our day and not just breast, but just in general. If you had one headache, no one's assuming they have like crazy cancer or, but when we have things that happen to us once, every once in a while, we kind of just ignore it.
Yeah.
But that's part of perimenopause because of the fluctuation in your estrogen in your body.
Yeah. So
Yeah.
are we getting when we do get breast tenderness around our periods or even during perimenopause where it could be at any point in the cycle, is it an increase in estrogen?
Yes.
Okay.
Yes. Yes.
And we just get all tender and
Right.
that. Yeah.
Yeah. Yeah.
Yeah, I would experience that too. Even just like since I first started my cycle, that's something
Hmm.
that I would experience for the most part. And especially
Yeah.
when I was younger, it's changed a little now. Now it's just like sometimes, not all the times. I feel like
Hmm.
factors, but yeah, it's like there's just
Yeah.
it's like, oh my gosh.
Very sore. Yeah.
Yeah, very sore and just
But very
there.
normal. Yeah.
Yeah. And then it'll make your breast a little bigger too.
It does.
So it's
It
like,
absolutely does.
yeah. And as a kid, I was like, come on, Lord, this is the
What's
last thing
going on? That's funny.
this is the last thing I need. Why do we have to go through this?
Right.
Please.
Man, women definitely go through a whole lot of stuff.
Yes, men don't know
Half of it.
the half of what it's like to be a woman. There's so many things
Yeah.
because they're just walking around with their chest out.
Right. They don't have to deal with anything that we have to deal with.
Yeah, women, a lot of women are still hiding their chest and they're just like, ah,
Right. That is so true.
gonna go work out
Oh
today or
man.
just sit
You're
around.
right. They
Yeah,
wouldn't be able to handle half the stuff that we go through.
no.
Not even close. Yeah. They'd be in the hospital all the time. I'm pretty sure. Yeah.
Yeah, they cough, they think they're on a deathbed.
Right.
So there's absolutely no that zap.
Yeah. Oh,
Zap
that would
would-
definitely scare them.
they probably would have started laying on the bed with a cross and a Bible,
Right.
something like this is it. This is how
This is it. I'm over. Yeah. Jesus, come get me.
this is how it is, oh Lord. Right. Yeah, they could do it for sure.
Yeah.
Okay, so are there any differences of what to expect between well in your breast between perimenopause and menopause, or is it the same?
It's really not the same because perimenopause is essentially you're going through, or let me go back. There's different stages. So you have perimenopause, menopause, and postmenopause. Perimenopause and menopause are very similar in their symptoms.
Mhm.
You just start, you're going through this fluctuation of estrogen like this all the time. And as you get closer to menopause, it's just more frequent. And then after menopause, which is postmenopause, a lot of women don't have any of the symptoms that they had before.
Okay.
Yeah.
So what I learned about like during menopause, we're lacking estrogen. Like we have less estrogen, right?
Yes.
So I guess in perimenopause, we're having more of the breast tenderness. And then in menopause, as the estrogen starts to go away, is it just, I mean, we just go back to
It
normal.
essentially gets better as far as the breast tenderness, like you're not having it as often.
Mhm.
And then once you have hit full postmenopause, then it goes away completely.
Then you just have just some breasts hanging around.
Yeah,
Like,
basically.
we're here for the ride.
Right.
I see. Okay, that's good. Is there, I mean, um, when it comes to that, I guess, are there ways for us to increase our estrogen out? I know you can do it in
Yes.
diet with
Hmm.
photoestrogens.
Yes.
Wait, did I say that right? Or
Yeah.
photo? Oh, okay. I was like, did I? I thought I was mixing up two words.
Two words.
But are there ways outside of that? Like, are there
Absolutely.
injections or something?
Yes. So there are some supplements that you can take that will increase your estrogen. I
Okay.
like to recommend like ashwagandha and black cohosh. My favorite is wild yam. I think that one works the best.
Wow. Yeah.
But when it comes to supplements, it's kind of hit or miss. Like some will work for one person, but maybe not work for someone else. So you really just have to try which one that works for you. And then you can also do something called HRT, which is hormone replacement therapy. So that would be like a prescription where you're either taking a pill or you have a patch or a cream that you rub like on your arm or injections of like the medication, which would essentially be estrogen.
Oh, wow. Okay. I
Yeah.
have heard of HRT now that you mention it. Now, did you say wild yam?
Yeah. Not the
Potato
actual
yam?
wild yam, but like the supplement. It's like a capsule, or sometimes it's in a powder, or where you can make like a tea or something like that.
Is it actually just yam?
It's a derivative of
Okay.
yam. Yeah.
Okay. It was like, oh, that one I haven't heard of for sure.
Yeah.
I was like, oh, wow, yams. Should we be eating more yams? And
Yeah.
oh,
That's funny.
I didn't know.
Yeah.
Why you're here? Because
I
I'm
know,
okay.
right?
But I like that. I think that a lot of women need to learn about it because they just kind of deal with it like, oh yeah, I'm going through menopause
Right.
and
And
dealing
there is
with
a solution. And it used to
yeah,
be where we didn't have a solution, but now we have, the science has evolved, and we're now focusing a little bit more on women to let them, feel better, and like they're not going crazy. But you're right. It's
yeah,
barely we still have a long ways to go. It's barely that we're focusing
yeah.
on women.
And
Yeah.
that's exactly why we're here. Like, for on your part, of course, like for women's overall health. For
Yeah.
me, that's part of like why BoobTube is here, just because it's something that a lot of women aren't talking about. A
Right.
lot of times, it's men that's talking about them.
Yeah.
So it's like it's time for us to have conversations about breasts and know different everything that we can possibly know about our breasts. And
Yeah.
then you think about it, it's like women, there's so much that women don't know. And then
So
you
much.
don't know until you know it.
Right. Until you're going through it and you think you're going crazy. And you're exactly where it's 100% what you're saying, that we don't talk enough about it. But also, our moms and our aunts, it was so taboo to talk about things like that.
Exactly.
So they never really talked about it with their daughters. So we, as the newer generation that are now starting to go into perimenopause, it's new to us, and we're just trying to figure out our way.
Right. And
Yeah.
that's exactly the word I was going to use, taboo, or even I've heard it as
Mhm.
taboob, as far as
Yeah.
like breaking the taboo. That's what one of our guests called it. Because even with conversations about our cycles and stuff, like
Hmm.
some girls didn't even have that conversation. They just started bleeding one day.
Yeah, exactly. Yeah.
Yeah. So there's so much, or maybe even the menopause, like, oh yeah, I'm just having these hot flashes. It's just a part of life.
Yeah.
And there's no talk about how, okay, your estrogen, you're losing,
Hmm.
like you don't have as much estrogen as you once had, and there's
Right.
things you can do to increase that. Like there's so
Right.
many things that isn't happening or was not happening. And I feel like now our generation, we're even helping the previous generation by like,
Yes.
yeah,
For them to even talk about it or get help or seek help. Yes, for
yeah.
sure.
Or it's like, okay, try this or try
Right.
that. And
Yep.
no. So yeah, again, just doing the Lord's work in
Right.
all ways.
In all ways.
Yes.
For sure.
Okay. So another thing that is pretty prevalent now that wasn't discussed back then so much, PCOS.
Yes.
What are some effects from PCOS that you can see in the breast or experience in your breast?
So PCOS is gonna, so how we were talking about the zaps, and how we were talking about the tenderness, you're
Uh-huh.
gonna have it off and on, because what PCOS does is it depletes you of what estrogen should be doing, but then maybe one day it decides to give you a little bit more.
Uh-huh.
So whenever you have PCOS, your breast can be tender, but it just won't be tender all the time, and it will not be tender at the same time every month. So it's just like a huge roller coaster of hormones going through your body, and it affects your breast in that way.
Okay. Is PCOS the one that has where some women start to grow hair?
Yes,
Okay,
yes,
okay. Because I was like, is that
yes.
one or another one?
And sometimes they grow it on their breast.
Yeah.
Usually it's here, but there are times where it's like thick, long hair on their breast. Yeah,
And what did they do?
fun. Yeah.
What
A
did
lot
they
of them will
do?
like pluck it and stuff just to make it go away, but you have to balance out your hormones for it to stop doing, the extra growth. And honestly, with science, we still haven't even developed something that completely stops it. We've gotten it to where it grows back slower or thinner, where it doesn't look as prominent, but there's still not enough medication that will just like stop it completely. Some women will do laser hair removal or electrolysis to help with that as well.
Mm.
And I would say it's about 80%, but there's still, that 20% that you may get it here or on your breast.
Oh man. And
Yeah.
so you said that we need to balance the hormones if you
hmm
have PCOS. So which hormones, I guess, are the
So progesterone, estrogen, and testosterone and insulin are typically the four, and DHEA are the five, excuse me, that are either, and it doesn't matter, all of them don't have to be out of whack. It could just be one. There are different types of PCOS, and it's really dependent on which one or two of the hormones are out of whack.
okay. And what is DHGA?
It is a derivative of testosterone. So it is an androgen. Testosterone is an androgen as well. A lot of times PCOS women have elevated testosterone, which is why they grow their hair here and on their chest. Like it's making you be more like a man than a woman. And DHEA is just kind of like a step down from testosterone, so it can cause some of the same side effects.
Okay, okay. Ooh,
I know, right?
I know.
You're out here struggling.
I'm happy to not have PCOS, but I also feel for the women that do because I
Right.
can imagine if I just suddenly started to have,
Exactly. Here somewhere. Yeah,
yeah.
it's crazy. It's crazy. But
So
now we have a little bit more medicine and technology that we know how to treat it a little bit better. So, science is kind of trying. Well, so far it's not as bad as it used to be. It's getting better. So we're doing the best we can with the resources that we have.
yeah. And I know a lot of people are doing like taking holistic routes too, like you mentioned,
hmm
ashwagandha and stuff like that. I think I heard about pine pollen helping with testosterone levels. I don't
Yeah. And
think,
spearmint tea helps out with it as well.
okay, yeah.
Yeah.
Woo.
I know. Tell me about it.
And that's another thing I think about just from previous generations. I feel like we've all encountered a lady with hair on her
Yep.
chin before, and it's
Yep.
like, did she think to maybe try to handle that?
Right.
Or what?
I've seen it. I really have. And it can be, embarrassing for a woman,
Yeah,
obviously. But when it's like you're waxing or plucking and, 2 days later it's back again, I
yeah,
can understand why someone would, not want to continue to wax and pluck every 2 days. It's
yeah.
a lot.
And now I couldn't help but to think about on Friday After Next, the movie, because
Yeah.
Pearlie had the mustache, and she's like, I know
Yes.
somebody who like it. So
It's
we
true.
probably all know a Miss
That's
Pearlie.
what she had.
Like, who knows? Maybe she did. It's
Right.
like, you might have
That is so true.
PCOS. I don't know. But it's just thinking about women who just dealt with stuff and just took it and never
Yep.
thought to address it or get
Yeah.
help. It's just like, this is my life.
Right. That's exactly what it's been because nobody had any answers for them. But now we have a little bit more. So
Yeah.
we're helping as much as we can.
Yeah. Because I feel like before PCOS, one of the things was endometriosis, and that was something
Yes.
that it
That
started
has
to
to be
get light
answered.
shed on it.
Yeah. Yeah. And we're doing better about that as well with the treatment plans for that also.
Yeah.
We still have a long way to go, in my opinion, for sure. But we've definitely made some strides.
Thank the Lord.
I know, right?
Okay, so I had a question about just hormones. Like you might have answered it in the last one where you named the hormones during PCOS, but just when it comes to hormones overall, like what are the main ones that we should be focused on when it comes to our breasts, or things that we need to be mindful of?
Okay, yeah. I will say it's still the same five, but in order, I would say of importance would be estrogen first, then progesterone, then testosterone, then DHEA, and then insulin. The thing that I, want to specify about insulin is everyone thinks insulin has to do with diabetes, and it doesn't always have to do with diabetes. Typically, when your insulin is low, it's more likely to do with diabetes. But when your insulin is high, that is insulin resistance, and it can mimic perimenopause. It can mimic menopause because it affects all of the other hormones. So yeah, that would be a good one to keep in mind as well.
And is what's the best way to keep the insulin down?
The best way to keep it down is keeping your glucose down, because insulin's job is to lower your glucose. And it essentially, if you eat some food and your glucose goes up, insulin's job is to go up to bring your glucose back down. So if you can keep your glucose low, then insulin won't have to stay up. So, of course, a ton of stuff that we eat turns into glucose in our body for energy.
Mhm.
So, but mostly carbs, rice and potatoes and pastas and things like that. Sugar, obviously. So, you're just trying to have a diet that has a moderate amount of those types of things so your glucose can stay at a good level and your insulin won't have to work so hard.
That was perfect explanation
Yeah.
and visual. Yeah,
Right.
that's a perfect breakdown for anyone that's tuning
I know,
in. They're gonna get
right?
that really easily. So yeah. And now I'm thinking about the fact I have some potatoes that
Right, right.
some baby potatoes, but I feel like I eat stuff in moderation, so I should be okay.
Yeah.
But
I'm not
yeah,
saying you can't ever have it. You just don't need to have
yeah.
3 plates of it. You know what I'm saying? Just like be normal.
Be
Yeah. Be
normal.
normal.
That's what they
Oh, man.
say. But normal
Yeah.
for some people, it might be three
But you're
servings
absolutely
of
right. That might mean
potato.
3 plates.
Yeah. So we gotta be specific.
Right.
Not just normal. Let's be specific.
Specific.
Yes. I'll say I just thought about it. There was another a hormone, and that was something I experienced where I had found that my prolactin levels were high.
Oh, I'm glad that you brought that up. Yes.
Let's talk
We
about
we always forget about little old prolactin.
you
So
know.
prolactin tends to be high in 3 situations. You either have PCOS, you
Mhm.
either, and I guess maybe 4 situations. Sometimes stress.
Right.
Um, then when you're pregnant,
Correct.
and then the big one would be a pituitary tumor. So
Mhm.
anytime I have a patient who has high prolactin, I don't ever start treating them for PCOS. After, of course, I check if they're pregnant, but I never start treating them for PCOS until they've gone to either endocrinology or neurology to get a MRI of the brain to
Mhm.
make sure that they don't have a pituitary tumor,
Right.
because the treatment plan is different. If they have the tumor, and those tumors are always benign, so it's not like cancer, but it does cause your prolactin to be elevated, and the treatment for that is different than the treatment for PCOS. So I always want to rule that out before I start treating them for PCOS.
Sounds like a perfect plan to me.
Yeah, yeah. And it doesn't happen a lot. I can probably say my entire career, I've had maybe 3 people have the tumor.
Uh-huh.
So it's not very often, but when it happens, you just have to make sure you follow the steps.
And how many people do you get that have high levels
I
of?
probably, I would say I've been doing this for 10 years and maybe 10.
Okay.
It's
So
not
not
frequent
that
at
common,
all.
yeah.
No, not at all.
Were you able to track down the source? Well, outside of the three who had the tumor, were you
Mhm.
able to were y'all like able to come together to figure out the sources of those women's
So a
hyper?
lot of times it's genetic, to be honest with you. Yeah. I would say probably 80% of the time it's genetic, 20% of the time it's environmental, meaning what types of food you're eating. And honestly, we are just not um we don't have access to the best food. If we really think about it, compared to 50 years ago when we ate everything that grew from the ground to what we
Right.
eat now, and then who knows what they're putting in our food now to make it, you know what I'm saying? And because I always think about, man, they're pumping these chickens and these cows full of, steroids, to get them bigger so that faster so that they can, put them on the shelves. And we are just eating it thinking, even when it says organic, I don't know that that's even a thing anymore.
Right.
So we just don't have the best options of food. Like even when you go to other countries,
Yeah.
you never see those women have any of the issues that we have. It is super duper rare over there because they're still eating things from the ground and we don't have all these pesticides and
Right.
yeah, we're
Exactly.
just yeah, we're feels like we're doomed over here. We
I'm
we just
with
don't
you
have no
there.
options. Yeah.
With you there. I
Yeah.
actually want to be an expat one day and go. I said that I would within like the next few years
Yeah.
relocate, but I mean for various reasons. But that's definitely something I think about for sure.
Um,
Like it's on
yeah.
the list.
Yeah,
Um,
they're starting to make it easier for me to want to get out this country too with all the stuff that's going on. It's,
for sure,
becoming like, why am I still here? So,
for sure.
yeah.
Like we
Yeah.
deserve better.
Yeah.
Um, so I did experience that, and I don't know what was the like what set it off.
Mhm.
I did do the MRI, and I did not have the tumor. So I think I don't know. Like I really just don't know. I think at the time I did also find that a steroid that I had been taking for a nasal spray, which I didn't
Yeah.
realize it had steroid in it. I think that that was too strong for me to take on a daily basis like I was.
Um,
So I think that that had some effects on my body
mm,
at the time too.
yeah.
And then uh I don't know, it could have been some stress too that
Yeah.
caused it. And then now it seems like it just wants to, I guess it comes and goes, but
Mm,
maybe during like higher stress periods, I feel like maybe it just kind of
yeah.
back up on its own because it was
Yeah.
so such an issue, I guess. That's
Hmm.
my theory. I don't know. But I do
It definitely could be for sure.
yeah, I try to keep it balanced and yeah, but that is something that I still and I'll see like the effects here and there and be like, oh, it's probably high, or sometimes I'll uh,
Yeah.
get the blood work. But I wasn't able to find like a good endocrinologist to help
They're
me.
tough. They are tough to find. One, and
Yeah,
when you find one, your appointment's like 6 months out or something crazy like that. There's not very many of them at all.
it's not. It was just,
Yeah.
and I just felt like they just wanted to prescribe me medicine for it, but I was trying to get to the root of it. Like,
Yeah.
well, what is even causing this?
Right.
So, yeah, that was a journey within itself.
I can imagine. It probably was your stress. And, I'm glad that you're even saying something about stress because, especially Black women, like I'll ask, a lot of my patients, do you feel like you're under stress? And we all say no. But
Right.
our baseline is higher than the normal
Exactly.
American. So when we say no, we're at a 10 and everyone else's no is a 0.
Right.
So it's something that we really need to like someone needs to study it, to be honest with you, because it's like a generational curse
Yeah.
that we put so much on our plate because that's what our mom did or grandma did, whatever, but our plate is still full compared to a normal person, right?
Exactly.
So whenever I ask women about stress, you really have to sit down and evaluate what you really are considering as normal because it probably isn't.
Yeah.
Yeah.
I think about that too, because I think I even asked my friend at the time, I was like, am I under stress and I don't know it?
Yeah.
Like,
It
and
definitely can be.
yeah, and I think about times where like I have to work a lot and I feel like I'm getting
Yes.
very minimal sleep, and I'm a
Yep.
sleeper. And
Right.
I
Me
could
too.
function. Yeah, I could function without it and I can catch up on it later. But I was like, I think when I go through long periods or longer periods than usual, then that's like stress on my body and
Absolutely.
really realize it. stuff like
Yeah.
that. So
Yeah. We really just need to pay more attention to our bodies. And because earlier when I was talking about like, oh, a headache or whatever, when we have small things that happen to us, or, breast pain or whatever, and then it goes away, we're just famous for brushing it off.
yeah,
Your body does really speak to you, and you just have to listen. And until you listen, then the next symptom comes, or a worse symptom comes, or it's more aggressive. And by the time we decide, okay, let me go do something about it, it's far, it's way further than it could have been. So, is you really do have to listen to your body because it does speak to you for sure.
for sure. I'm with you 100% on that one. So, okay. All of this was very great, and I'm glad we were able to touch on prolactin because I feel like
Yeah,
that's something
nobody's
that
talking about
isn't
it.
really talked about. And then
Yeah,
also just to add, because you said that it can be high in women who are pregnant, and that's because lactin, lactate, it goes along with the lactation. So
right,
that's something that could be experienced despite pregnancy, just
right,
of prolactin. So just for viewers' sake, so that
right.
you know, like, well, they're talking about this prolactin. Like, what exactly does it do to the breast? Like, yeah,
Yeah,
it helps the.
exactly.
That's
Speaks to
what
my
it's
speak.
really for. So when it's high and you're not
You're not
pregnant,
pregnant.
that's an
Yeah,
issue.
yeah.
So yeah, just putting that out there. There's so much that we have to take into consideration, and I feel like there's light being shed on hormones and stuff now more than ever before. And
Right.
all we can do is be grateful for that and
Hmm.
pray that people continue to do the Lord's work in their
Right.
specific areas so we can have our health together from all different angles.
Yeah, you're
And
absolutely right.
yeah, so I appreciate all of the great information that you have provided today. Do like to end with words of positivity or
Okay.
positivity. So anything that you feel on your heart to share that's a little positive statement for the viewers, just let that on out.
Okay. I would just like to say, in the midst of whatever's going on in the world and how Black women feel like they are not cared for in medicine,
Mhm.
this is a safe space, and we and myself have created this clinic specifically for Black women. Now, do I have other patients that are of other races? Of course, I would never turn anybody away, but the what I want to say is we love our Black women over here, and we want to help them get to the root cause of whatever may be going on with them and help them find a good treatment plan.
Yes, I love that. And just let them know that you are welcome here.
Yes, absolutely.
And let them know exactly where they can find you. You mentioned Montrose area. You can drop the address,
Yes.
website.
It's 1622 West Alabama Street. We are the big gray building with the pink door and the big mural flower with the vagina on the side.
Lovely. And your socials.
So we are on TikTok, we are on Instagram, we are on Facebook, and all of them are at her down there.
Love it. And I love the name too because
Thank you.
yeah, I feel
Good
like
catch.
it's catchy and sometimes you just gotta be out there with it.
You do, and
Yeah.
you'll never forget it. So yeah.
Yeah. You got the insurance man saying, call come what is he saying? It's his name is Dick, but he always says like
Oh, I know exactly what you're talking about. I've heard that commercial, and it has Dick in like the don't
cursive.
call it. So I don't know what it is, but
Like,
I know exactly
yeah, I'm
what you're
like,
talking about.
however he puts it, it's always like,
Yes,
let me see if it's
but
there.
look, it caught both of our eyes, and we exactly know
Yeah.
exactly what it is. Yeah, so it works. Sometimes you got to be out
Exactly.
there. Yeah,
Exactly. So I like for it to just be out there. So her down there, make it pretty with the flowers. And
right,
love it. It's a flower.
right. It's a flower.
Yes. Okay. So thank you again so much
Of
for
course.
joining. And I hope that you have a great rest of your day while you
Likewise.
tend to the women that need you in this world.
I thank you for having me. I really appreciate it because this is how we get things out to more
Yeah,
people.
for sure.
Yeah.
All righty. Well,
See
until
you
next
later.
time, best of luck with everything. Have a
Same to you.
thank
And
you.
we will talk hopefully soon.
We will, we will. All right.
Okay, bye.
Bye. Hope you enjoyed that so much. Make sure that you check out our guests. If you're in the Houston area, check out the clinic. It might be just the right one for you. And make sure that you are following on all the socials and that you check out BluetoothPodcast.net, get you some merch and look up some other stuff that you might want. Be sure to join again for the next episode as we're going to stay in the same topic, the realm of health. So make sure that you join us again. Until then, adios.